first question is, do you exclusively identify with one kingdom or more?
I really identify with the three kingdoms that have been discussed at this meeting, because I'm both an ultrasonographer, an hysteroscopist, and a reproductive endocrinologist.
And what is the best weapon in your kingdoms for infertile patient management?
There is always room for improvement. I guess evaluation of the uterine cavity properly through a combination of ultrasound and hysteroscopy is one of the best weapons we have to improve our results.
If you could fight for only one modification or update in the latest recommendations for the infertile patient management, what would it be?
What I usually do is perform a sonohysterography with saline solution, and according to the finding of the sonohysterography, I go ahead with hysteroscopy. And I think an important thing that I do is to use a one-day infertility visit, one-step infertility visit, where I do both the first evaluation and the antral follicle count and the sonohysterogram for evaluation of the uterine cavity, all at the same time, so that the patient gets a complete evaluation in one step.
What is your unpopular opinion among others in your kingdom community regarding the infertile patient workup?
I'm not sure I understand well these questions, but it probably means that people in my community, in my kingdom, don't agree with something that I do. So one of the controversial issues is the treatment of dysmorphic uteri, arcuate uteri, T-shaped uteri, and I always discuss this with the patients and perform correction, surgical correction when indicated, depending on the patient's history and situation and ultrasound criteria, etc.
Thank you. So, at present, what is the most medieval practice in your kingdom for the infertile patient?
Blind procedures, let's say, in general, are the most medieval procedures. In this way, for example, blind DNC performed for thick endometrium or polyps or suspected endometrial cancer, and even for missed abortion. For example, we perform embryoscopy. We recommend embryoscopy in all cases of missed abortion for the double reason of being less invasive and being able to evaluate chromosomes in the embryo.
For the purpose of the win, that is the fertility outcome, who holds more promises? Who is the strongest as a partner among the other two kingdoms?
If you have to choose, you probably cannot have success without an ultrasound. So if you have to choose, I think that would be my answer. However, if you see something wrong by ultrasound, you're obliged to go on with surgery. So, it's...
Thank you very much. And the last question is a provocative question. If you could choose only one knight to duel, to challenge, who would he or she be?
I guess again, ultrasound. I mean, I cannot do an egg retrieval or an embryo transfer without an ultrasound. I cannot diagnose uterine pathology without an ultrasound. So that's my strongest partner in this kingdom.
Thank you very much.